All right, there we have Simeon Brown, the Minister of Health, just before the news, laying down the gauntlet. I've got to say, I was horribly tempted to ask him what his mum had packed him for lunch today, but I curbed my enthusiasm and my sense of humour in that regard. So he basically says we are spending more on health. He doesn't want to get into the trans issue. He doesn't want to get into the ethnic discrimination at medical school question, does he? He was stepped round that. And he couldn't give me a big ballpark figure for how much more a year this government is spending on health. But he didn't paint a picture of a health system in crisis. And he was very disparaging of the PSA's survey, which has been slavishly reported in mainstream media. I thought, given the attack on Monday, which has been repeated on the program this morning, it would only be fair if we asked the PSA and its head, Fleur Fitzsimons, to join us this morning for a right of reply, for a rebuttal, and Fleur Fitzsimons indeed joins us now. Is it Fitzsimons or Fitzsimmons, Fleur?
No, it's Fitzsimons, Sean, and good morning.
Good morning to you. First, can you tell us about your survey?
Yeah, so look, what we've done is we've surveyed members of the union who work in the health sector, and we sent them a survey in late January, and really we asked them to share with us in, it'll be familiar to you, free text form, what their experiences are of working in health.
How many people in your union work in the health sector?
We have over 20,000 members in health, but they didn't all get the survey.
How many did?
We did get 12. We're not entirely sure, but many thousand got the survey, and we've already had many people come to us since it's been reported in the media and say, oh, I really wanted to fill in that survey. Can you please do another one? I've got so much more to say. Well, for various reasons, and we all know what it's like when you get an email. But look, we've got the voices of over 1,200 health workers in the survey.
So is it really a survey, or were you just writing to people asking them to have a bitch?
It's both, really, and it's not really a bitch. I would say it's health professionals being able to share their frustrations and experiences in the health system.
Okay, the minister said most of your members are actually in admin. You're not really like nurses or doctors.
No, that's not correct. We have members in administration, and those are very important roles. So I don't know if he means
what proportion of your members in the health sector are in administration?
We've got many thousand members in administration, but can you just let me talk about what those administrators do? Because what they do is absolutely critical. For example, they schedule clinics to make sure that surgeries can take place. One of the respondents in the survey said, and I'll quote directly from her, and it will be a woman because the vast majority are, services cannot be used to full capacity as there is a lack of schedulers to fill clinics.
Where does she work?
So the resources of I don't know, and we didn't. These are anonymous responses. Booking slots are not available because there are not enough schedulers to book the clinic. And look, this story will be familiar to your listeners because they know that waiting lists are too long and that surgeries are being put off. So it actually speaks to the experience, and I've got family members who listen to your show, of family members in the health system. We know there are health professionals doing their very best to deliver health services, but those administrators are absolutely critical. But we have other roles as well. We have dietitians, we have nurses, we have health promotion workers, we have, and also importantly, IT and data and digital, and they are under attack by this government.
So, Ms. Fitzsimons, you came out, though, the headline you got out of your survey, and I think we have to agree, we're using the term pretty loosely here, the term survey. The headline that came out of it was what? 85% of health workers, think it's in crisis?
81% said the cuts have damaged services, and 86% said that cuts will make it harder for people to get health care.
And that's out of how many respondents?
1,200.
Out of how many people who got the inverted commas survey?
Many thousand people got the survey.
Well, how many thousands of thousands?
Well, I'm not sure of the precise number.
You're not sure? So you cannot in any way, and because there's no statistical robustness to your survey, because it's self-selecting, there's no way you can all honestly say that 81% of health workers think one thing and 86% think another thing. It's just not true. It's just kind of made up, Fleur.
Do you want me to speak?
Yeah.
If one person is in a building and it's on fire and they're shouting fire, we take them seriously. We've got 1,300 health workers who work in the health system every day saying there are problems, it's in crisis, and the stories they're telling are consistent. They're stories around vacancies not being filled. And if the minister was serious about addressing that, he could say today, all vacancies at frontline health services should be immediately advertised and there is no hiring freeze. Yeah. He could say that, he could announce it, and every manager and every worker in the health system would be able to advertise roles
let's get
immediately.
Back to the facts. You said there are 1,300 people saying that. Are there 1,300? How many people responded to your survey?
Just over 1,200.
Okay, so 1,200, but it's only 81 or 86%. So that's not 1,300 people, is it? Saying what you just said.
No, and those percentages are reflected in New Zealanders.
And who did the numbers on that? Who did the numbers on that?
Do you want me to finish, Sean? I don't know.
I'm just trying to get the facts, Fleur, rather than...
Please let me finish.
Okay.
I've shared with you the
Okay, well, my
facts.
question is, who did these numbers and analysed this data?
Union officials within the PSA.
Okay.
And look, but Sean, the thing I would say to you is the minister hearing different from the public? Is he hearing different from other health workers? Is he hearing different from patient advocacy groups? Because what I'm seeing reported and what I'm hearing is a consistent message from those groups. And it's a message of concern about what is happening in our health sector. And it is genuine concern.
Okay. All right. He's also raised, I think, and in many of the public's eyes, I might say in many of my listeners or followers' eyes, a legitimate concern, and that is that you really are just a career politician. And the union is really just like a branch of the Labour Party. I mean, how did you get this job? You fail as a candidate somewhere and suddenly you're the head of the PSA, Fleur. It kind of looks like a self-fulfilling prophecy, and you're really Union's Labour Party, you know, togs, undies.
Well, I'll first of all tell you that it's not surprising that the union movement and the Labour movement and the Labour Party have some people who are active in both. That shouldn't
some
be a
would say
surprise
connected
to anyone.
at the hip. Yep.
Absolutely, but the PSA is a non-partisan union, and I've worked there for over 20 years.
The PSA is a non-partisan union. Okay. How many National Party candidates work or have held office in the PSA? None.
I can recall, but...
None, but it's non-partisan, right? How many acting MPs or candidates or office holders have ever worked in the PSA or held office in the PSA?
I don't know that any of them have applied.
None, isn't it?
Well, it's not surprising, is it? Because our values are totally different and completely in conflict. But look, these workers in this story are ringing alarm bells about
I don't know who they are. They're all anonymous.
System.
I have to trust
you.
Let
me tell you about one of them.
What's this person called? Before you make up a story, who is this person? Where do they work? What's their name?
I'm not going to share their name with you,
Then I'm not going to listen to your story because it could be completely fictitious, Fleur.
Well, you listen to it and then decide.
No.
And look,
I'm not going to let you propagandise on this program and make stuff up. Like you made up the fact that 81% of health workers believe this has caused cuts in frontline services and 86% say we're in crisis. Those are all made up figures, Fleur.